Hello. Welcome to the Living Well podcast. My name is Dr. Perin. I'm a psychologist in the great state of Ohio, and with me is my co-host, Pablo Madrigal.
Hello. Welcome back.
Yeah, today we are going to be talking about how and why most therapy fails the intelligent or highly successful, mostly because it isn't entirely designed for them. Yeah. Pablo, you want to tell everybody how they can get involved?
Yes, of course. Welcome back to the Living Well show after a couple of weeks away for myself. So remember they were broadcasting, streaming live on X and on YouTube at Dr. Perin. So tell me, Dr. Perin, so therapy doesn't work?
Yeah, I confess I buried the lead a little bit with that one. Of course, therapy works, but I think it's important that we talk about what kind of therapy, when it fails, and what therapy works well with people who are already fairly successful in their own lives. And I want to be very broad with my definition of that. Success can mean a lot of things, whether it's financial success, professional success, they're married, they have children. People who most would consider are fairly well put together, but still suffer in all of the ways that humans do, with anxiety, with depression, with despair, with parenting issues, with issues with their own parents, et cetera, et cetera. Success does not protect you from suffering. I was reading a pretty interesting article about Harrison Ford. Harrison Ford was talking about how he struggled with depression, both in college and I think throughout some of his professional career. And I think that really got me thinking, yeah, even arguably one of the greatest actors of all times can still suffer from mental illness. We should talk more about that.
Wait, so therapy works, just not for the people that really need it?
Well, I guess I'm talking about modern therapy. A lot of it's become very popular to get branded psychotherapy, like really, and I'm not exaggerating when I say like they trademark the titles. They usually put I've heard it referred to as alphabet soup therapy. CBT, CPT, ACT, DBT.
Oh, I see.
These are all these ways where, unfortunately, people who created fairly decent models of working need to make a buck, and they have to sell it. Right now, the biggest culprit is something called IFS, internal family systems, and I don't want to attack the actual theory. It's a really great metaphor that we have sort of these internalized versions of family members, roles, expectations. They're not the first to come up with this metaphor, but their whole model of training, their whole model is they have like a lottery for people who are interested in going to the training. So like not only do you have to pay for the trainings, you have to get a lottery for, there are only so many slots available. It's sort of this false or manufactured scarcity to even get the training. It's a way to make money. And I
was gonna say this kind of sounds like one of those join my seminar to know how to treat this so and so, but you have to cough it up first, almost like not a pyramid scheme, but
it's a little bit of a pyramid scheme.
That's kind of what it smells like to me.
A little bit, but this is part of the professional development. So I'm a psychologist, and we have continuing education credits. We those continuing education credits have to be sponsored, and every 2 years to renew our license, we have to submit these CEUs for licensure. And most licenses are the same. Even attorneys have to do their like biannual continuing education stuff.
Yeah.
The thing is that late career clinicians they want to find other ways to make money. They have children, they have responsibilities, they might need to buy a new house, and they don't want to extract it from clients. So training education is a way to do it. But it's really gotten out of hand. I really blame Aaron Beck. I blame him for a lot of things. The Beck Institute and cognitive behavioral therapy is It's really just like they do their own credentialing. They sold their worksheets. Like they found a way to make money. And most of these branded psychotherapies are emulating the business more than actually training how to do psychotherapy. So like I don't say that I'm a CBT practitioner. I don't say that I'm an IFS practitioner. I say I'm a psychotherapist. I'm trained in doing psychotherapy. I've never done the same psychotherapy twice with in my entire career. People are different. People are
Do you
entirely different.
think is it possible that um oh hey Daddy
Yeah, my
putting
assistant's
yourself
showing up.
putting yourself into any of those acronyms um kind of like narrows down what the perception of what from people what you would be able to do, or kind of like uh puts you in a niche
Into a
and
box.
into a
Yeah.
box.
Well, I am advantaged. I'm a psychologist, so I can market myself as a psychologist. A lot of masters clinicians, a lot of people with different licenses, the LPC, LCPC, this is an additional way to do marketing. They can say I'm an IFS therapist or I'm a DBT therapist. I have my certification in dialectical behavior therapy and I do dialectical behavior therapy. But that means that they are specializing, and people who are looking for dialectical behavior therapy will find these therapists. But uh, unfortunately, a lot of these are just very short term. They're very brief because they're manualized. Like you have to hit all of the different beats. It's traditionally 12 weeks. Some are even briefer, but it doesn't really have long term change in mind. It has sort of here's some skills, get on your feet and go. But successful people who are highly intelligent, they're already skillful. Like
Hmm.
they already have. If you tell like a movie star or a pro athlete, oh, let's do some breathing exercises, they're going to be like, I know how to slow down my heart rate. Like I'm looking for a little bit more than breathing exercises.
Hmm.
And again, they'll pull out worksheets. A lot of these are like worksheet therapies, and that they're like, we don't need a proctored self-help book.
Who pulls out the worksheet, the patient or the therapist?
The therapists,
Oh.
unfortunately, a lot of cognitive behavioral therapies are built around more about reliability. If I'll pick on the VA briefly because the VA loves their manualized brief therapies, and they want to make the therapist the most replaceable person in the room. If you're on session 4 of cognitive processing therapy and you move and you go to another hospital, you can pick up on session 5 with another clinician. It's going to be the same opening statements, it's going to be the same homework
Hmm.
assignments, it's going to be the same worksheets, it's going to be the same lectures. But it's not really psychotherapy. It's a proctored self-help book. And
Right.
again, intelligent, successful people, they know how to fill out a self-help book.
Yeah, yeah, yeah. I mean, it almost sounds like you could put it into a spreadsheet and just carry it around and kind of have a little your own worksheet of mental health
Uh,
progress.
Precisely, but also if you've trained enough, if you've learned enough of these like 12-week manuals, you don't have to use their copyright branded worksheets. You can make your own worksheet, or you can ask questions to challenge beliefs because you understand how they're structured. So I haven't used a work. I didn't have my dog on my lap, I'd get up and I'd show you my stack of the dialectical skills, the DBT skills workbook. It's this thick. Each one is a different like homework assignment or a different worksheet. I have skills for days, but that doesn't often lead to change. Now, if I give skills to a intelligent or successful patient, it's not because I think I'm smarter than them and oh, I just know all of these skills that they do. I actually want to see how they resist them because that is going to be more clinically relevant in the long term because
Hmm.
they've probably heard advice, they've probably gotten coaching, they probably have coaches. If they're high enough in their profession, they have mentors. I want to see
So
how they're
then,
resisting that stuff.
so then when one of these smart, high achieving people see these mechanisms of doing therapy via worksheets, and they go, I do worksheets at work. Like, why do I have to do this? I can just kind of document it myself and reverse engineer it, if you will. And then they end up considering therapy just pretty much BS. No.
Oh yeah. I was talking with an attorney friend of mine. She was talking about how she did a cognitive behavioral therapy and it didn't work for her. And I was like, well, yeah, because you're probably already good at intellectualizing, and CBT just teaches you
Right.
how to intellectualize. And she was like, oh my gosh, yes, they didn't teach me anything I couldn't already do. Now, that's
Exactly.
not to say that intellect, like teaching this is good for people who are maybe more emotionally, probably do a lot of emotional reasoning. Like, I feel bad, so the situation is bad. All right, let's actually challenge that. Let's actually think about that a little bit more. Uh, I like Albert Ellis's rational emotive behavioral therapy because he just challenges you. He's like, let's actually, like, how accurate do you think that is? And he'll say it more humorously. But people who already do that, again, she's an attorney. Like they do logic. Like their whole job is let's think about this. So if a CBT therapist goes, hey, let's think about this, they're gonna be like, that's all I do. That's why I'm suffering. I'm always thinking about it. I'm not feeling. Help me
Does that
feel something.
is that why people would say that therapy doesn't work for them?
Yes, I
Because
absolutely will. I will go on a pretty bold claim and say yes. Like if they are getting this kind of therapy, these manual focused worksheet psychotherapies, they are already intellectualizers. So they are hearing stuff that they already can do by somebody who probably is just going through the motions. They've said the same thing 4 times that day.
So is that would that make does that make that kind of people harder to treat? And how do you work around that?
Well, I don't want to sound too confident to say that that makes them harder to treat, but
Do it, brother. Do it.
I think that makes them harder to treat if you only know manualized therapies. If the only treatment approaches that you've learned, like you've had to do weekend workshops to get a certification, then yeah, they're going to get pushback, and you're going to look at the manual going, "Oh, they don't cover this pushback in the manual."
Mm.
When you're actually trained in psychotherapy, when you actually do, so I'm a psychodynamic therapist. Psychodynamics is the formal scientific study of the interaction and interdependence of psychological variables at different levels of awareness. That's a fancy way of saying that
That's very fancy.
we're not always aware of what's going on. What Freud called the unconscious, for example, is something that is outside our immediate awareness. And a lot of these manual therapies aren't really focused on insight oriented psychotherapy. They're focused on, like, just let's do skills training. So I don't think it's difficult because very often I can get into that unconscious really quickly and really early. And sometimes they will feel something. These, again, are very intelligent, very successful. They have achieved a high degree of success in their careers, and all of a sudden they're feeling something for the first time. Like they'll sit there and they'll go, oh, or they'll cry, or they'll start shouting and they'll say, oh, I'm sorry, I don't know what came over me. Bam, now we're connecting with something that you're not entirely aware of. Let's keep going. So I don't think it's harder to treat per se, but
So
this is the kind of training that's missing.
what you're saying is they're looking for depth in the therapy, and they're looking for deeper, finding deeper answers, and not just you know diagnosing a symptom that they probably already know what that is. They don't want you to tell them how to fix it. They just want to understand it deeper, right? Because I think that goes along with their own intellectual capability, and you know possibly even emotional awareness,
Mhm.
or emotional intelligence as well. And they just don't know how to reach deeper to really get to the resolution of it.
Yeah, I would say self understanding for one.
Right.
My field is really predicated on the recognition that we don't really know ourselves as well as we might think that we do.
Right, right, right.
And I've been using this term a lot lately, needs, pursuit, efficiency. I think it's fairly explanatory that we do have needs, but we often act against them, or sometimes we don't know what they are, even before we figure out what's holding us back from achieving them. So self-understanding, that part where we're really trying to know who we are, making the unconscious conscious, we go, hey, now I know what's really important to me, or hey, now I know how I'm being held back from achieving my goals. I'm gonna be less hamstrung. I, I watch. I grew up watching a lot of Looney Tunes cartoons, so like I think of that old like old timey ball and chain around the ankle, like when they have the
Mhm.
striped outfits in prison and they're just like hitting rocks with a tiny
Yeah.
pickaxe. I really see that as like we have these balls and chains, we have these shackles around our ankles that are slowing us down, and very often making the unconscious conscious, these and improving the needs, pursuit, efficiency is like unshackling or removing that ball and chain. Like we're freer, we're more efficient, we're more effective at pursuing our goals. That's what I think the ultimate aim of psychotherapy is, not following a script.
Right, right. So, um, so there's it seems to me that there's a disconnect somewhere between these acronym types of therapy and high achieving intelligent people, right? Where would you say that is? Where does that lie?
Well, I would have to say that it comes from a lack of training, or rather the focus of training over the last 15, 20, 30 maybe years. Uh, Clinicians are taught to memorize these brief acronym therapies and to only do these brief acronym therapies. So they get very confident, but they get maybe a little overconfident in just doing the same thing over and over again, that they're not really aware that there is more that can be done. I was thinking I was thinking about one of my students not too long ago. She's in training to be a psychotherapist, and she had a very tough session, and I used the term countertransference with her. And countertransference is kind of like therapy 101. If you're in a room with a patient, you're going to feel something. You're going to have a response to them. They're going to remind you of other patients. They're going to remind you of yourself. They're going to remind you of other people in your life. And that makes us feel things, or it makes us think things. And when I said it to her, she was like, "What? What is this? What is countertransference?" And I almost pulled my hair out because she's in a doctoral
Oh,
program, and
yikes.
it's not being taught. What's being taught is, oh no, we don't have countertransference. And I'm like, oh no, if you're alive, if two people are in a room with a pulse together, you're gonna have a reaction to that. But that it's not a bad thing. Understanding that actually helps us deliver therapy better. We can learn how to use that in the therapeutic process
That
skillfully.
that that to me sounds like that new wave of parenting and even dog ownership, not to compare kids with dogs, but a little bit comparing kids with dogs and saying, well, you don't say no. You don't use the word no.
Oh yeah, the
Actually,
gentle
no.
parenting.
Yeah,
Yeah,
get the hell out of here. The word no is the best word in the freaking language. No.
but I
But it's like we were saying, no doesn't exist anymore. It's like, okay, countertransference doesn't exist anymore. Okay, just because you don't think that that it's like an appropriate or a right thing to say, or a correct approach, or a right terminology anymore, it doesn't mean that it doesn't exist just because
mhm.
you're not gonna willing out of existence.
I completely agree, and I'm really glad that you brought up the gentle parenting, because that I think that's another aspect of this, because you get these therapists who disavow their own anger, their own frustration, their own annoyance. They will show up in the therapy room like, "Oh, oh, I'm just here to love you. I'm just here to help. There's no wrong answers." I can tell you, working with like very successful, high achieving, and intelligent people, they want to be called out on their bullshit.
Oh,
If they're
100%.
doing, yeah, I want to be called out on my
I want to be
bullshit.
called out on my bullshit.
Uh, the way I describe this is warmth and firmness are two wheels of the same bicycle. You need both of them to go far. I'm not saying that you don't need to be warm. You also have to be firm. You also have to be like, I think that's a crock of shit. Let's explore that. And just be very direct about it, because they're going to go, thank you. My last therapist was like, there's some TikTok influencer who's like the Miss Frazzled, I think is her handled. I don't want to call her out. She has a really good performance where she's going, no, everybody, catch a bubble in your mouth. Okay, now that you're quiet. No, those are bad words. We don't use those. Are no words. We don't use those no words. Imagine a therapist like that. There are tons of them. Now, this profession does tend to draw in very warm, very compassionate people. These are people who bring that warmth into the therapy room. They struggle with confrontation. They themselves, the therapists themselves, struggle with saying, I think that's bullshit. I think the common denominator is you in this scenario, or I think you're the asshole in that event, right? It's important to be able to connect with that.
Right. So, okay, who is this modern therapy for? Who does CBT, where does CBT work well, for example? Or, insert your acronym here, but basically, I guess who's this modern therapy for?
I want to be very particular with my language here, because I don't want to say that it's bad. It does have a use. I think CBT is a good start. I think these manual therapies are a good introduction to therapy, both for people who have never done therapy before, but also for clinicians who don't have a lot of experience with the process of psychotherapy. I was very thankful for CBT skills when I was a trainee, when I was a student, because I didn't actually have a lot of experience yet. So I could look at a binder and go, oh, what do I do next week? What do I do next week? And it was great to be able to pull some of those things out of my pocket. Another group that really benefits it are systems like hospitals, where they have an enormous amount of people and very long wait lists.
Sure.
So the VA is a really good example of this. I would have to explain this, that, even though there is more for us to do, you are in a better place now after 3 months, and there are other veterans who are really struggling and they need this time slot. And veterans are very generous, especially when it comes to helping other vets. So they're like, please give my hour to somebody who needs it more than me. Then I want them to go out in the community and find a more psychodynamic therapist, maybe a private psychotherapist who can continue where that goes. But if you have 100 people and only 5 clinicians, you need to be able to have turnover, and that's very difficult.
Yeah. Well, here's I'm gonna try and put this into my world scenario, just for those who are listening that are like myself, not therapists. The way that I see or I interpret what you're saying is, in my world, you have your recipes, right? You have your cocktail recipes, you have your dish recipes. A good chef will use that word, the recipes, or the knowledge of those recipes, or a good bartender, and use them according to the case. But it's not a blanket. I'm not just going to use the same old-fashioned recipe for every whiskey cocktail. I'm not going to use the same margarita for every tequila cocktail, and so on and so forth. A young starting bartender will look at those formulas almost like gospel. No, this is what it says. It's 2 ounces of this, 1 ounce of this, half an ounce of this, and then just stay within those boundaries. But once you understand the fundamentals, and once you understand how they apply, and you can kind of bend those recipes into creative, completely original new things, that's how I would explain it. Or, for example, I remember a young person that started in our company got the employee manual. It was pretty much as any decision, or any kind of any kind of decision, or sorry, situation that required decision making, he would go to the manual and say, okay, what does the manual say? They go, brother, this is a guideline, you know? And then you read that thing once,
Yeah.
you put it in your drawer and you go. You can't just stick to the book, literally speaking, because that's just, it's never going to cover every single possible scenario. So that's kind of how I see these types of therapy that you're mentioning kind of go, is they are guidelines. So they're there for you to use whenever possible, right? And they are but if you try to stick with them, and it's just become a blanket type of therapy for every patient, it's just not real world viable, right?
Yeah, I think of you're making me think of a Pablo Picasso quote, and I'm going to butcher it here, but he talked about studying the masters. You need to learn the rules so that you can learn when to break them or how to break them. So like I'm really boring. I'll follow a cocktail recipe and I'll find something good and I'll make it and I'll be measuring it out and I'll be like really looking to make it right. One thing that I really appreciated about you, I remember when you got your first like head bartender role, you were asking people what liquor don't you like? And it's
Oh,
like, oh,
right.
I hate gin or I hate tequila. And they'll be like, I will make you a gin drink. I will make you a tequila drink.
You're gonna
And
love
I'm
it.
gonna make you if you hate it, I'll make you another one and I won't charge you for it.
Right.
But like I'm gonna make you fall in love with this. And that always impressed me because I'm such a beginner. I need the guidelines. I need the 1.5 ounces. All right, let me measure out 1.5 ounces. I think this is the same way. And this is why I don't want to say that CBT or these alphabet therapies are bad. They're just a good start. Some of them can also just be a scalpel, right? Some people, they say, hey, listen, I just want something. Insomnia is a really great example. There's a cognitive behavioral therapy for insomnia. It works. If you have insomnia, we can make sure that you're sleeping the hours that you should be sleeping ish within about 12 weeks. And it's very like concrete and very structured. That is like a scalpel. It is like an expert. It's like a surgeon just cutting out the one thing. Unfortunately, very few people just have these specific individual time limited problems. Most people, their issues are lifelong, they're pervasive, they integrate into so many other realms of their life. And I can tell you, after now having years and years of experience, much like you when you were selected to be a head bartender, um, I know that some of the deepest stuff don't come out until after about 6 months of psychotherapy. Like we'll address the initial concern, we'll get these immediate gains, what I call the consultation period. During the consultation period, we'll get some really great newbie gains. And for some people, that's enough. For some people, they said, thanks, that solved my problem. I appreciate working with you. But most people are going, this unearthed so much more stuff that I did not know that I needed to work on. Like this goes back through my entire life. I need to work on this, that, and the other. And that's why some people say the first few months of therapy is just a handshake. We're just getting to know each other. The equivalent of you saying, what cocktails, what liquor don't you like? I will,
Right. Yeah.
I will challenge you. I will challenge your beliefs on that.
Right. Right. So, what do therapists, what do these therapists get wrong with clients, with the high achieving and intelligent clients? What is Yeah.
Oh, I would say more than anything, the oversimplification.
Mhm.
If if you have if you if everything looks like a nail, or sorry, if all you have is a hammer, everything's going to look like a nail.
Oh, right. Yeah, that's a good one.
I was talking with a colleague earlier. He took something that I said to be an insult, and I had to correct it because he is one of these brief solution focused therapists, and he's great. He's one of the best at it. He's so kind and giving and generous when he's doing the Socratic questioning, which is not answering the question, just sort of asking more questions so that people answer their own or solve their own problems on their own. I've seen people where they'll raise their voice an octave. Oh, what makes you think that? And they have like a small smile in the corner. Yeah, it's a little repulsive. But like, I know what you're doing. Like, it's clear that you're trying to get me to challenge my own beliefs. I'll do it. I'll play along, but it doesn't feel great.
Yeah, yeah.
So like my colleague who's great at it, he's just very compassionate and he's very and you can see it in his eyes when he's asking these questions. Is like you know I care about you, so I'm going to challenge this, or I'm going to ask you questions, and I'm going to have you kind of fill in the blanks with your own with your own knowledge here. Um, the talking down, the sort of patronizing, kind of like the Miss
Yeah,
Frazzled, the catch a bubble in you. Those are no words. We don't do that in therapy. Um, it's gosh, I've run out of a therapy office. One of my when I was shopping for a therapist in grad school, I remember there was a guy where he would just make these superficial facial expressions like mm, mm, mm.
I'll be like, "Are you okay, bro?
Right. I
The
was just
hell's
like,
wrong with you?"
do you need therapy?
That's just
uh,
that just feels, I mean, disingenuous from the beginning.
Disingenuous, that's a good word for it. I I think there are some people who really come across disingenuous, and I don't actually think that therapists have to be super high IQ themselves. Like if they're working with a really smart patient, some people say that you need to have a really smart therapist. That helps, but I actually don't think that that's a necessary ingredient. You just have to give a shit. You just have to be able to go like I don't understand that, but help me understand that. Like I care. Like can you try to dumb this down for me?
Yeah. I feel
Um
like that's something that would just make someone go, "Oh, this is just not for me." You know, if you somebody that has that picks up on social cues like that, somebody that's, the people in question, right? The people that would think that therapy is not for them
mhm.
would probably pick up on those things right away. Oh my God, this guy's just making shit up, you know?
But the real danger is that they're going to overgeneralize that to other therapists.
Right.
And I I really wish it was seen more like an interview process, like get 3. Sign up for 3 different therapists. Go to all 3 of them. Unfortunately, that costs money. But like do a couple weeks with each of them and then go like this is the one I vibe with. This one hell no, like I was done after the first session. I don't even want to give this guy a second chance. This one's okay, but I'm really vibing with this guy. I'm going to go with this guy. If there were more of an opportunity to shop around and do kind of trial and error, people are going to know, okay, so it's not all therapists. Not everyone does it this way. This is the one that's more aligned with the goals that I have, or this one's approach to therapy is more aligned with the kind of treatment that I want to get. Oh, oh, that would be so great. I really think that the ultimate goal of a therapist isn't even to cure their patient. Um, it actually is a lot of hubris to think that you're the therapist that's going to finally cure and solve all of their problems. At the very least, you need to give them a good enough experience that should it be their second therapist or third therapist, eventually they're going to get one that will get
Mhm.
that final step. Um, the ultimate aim of psychotherapy is to be a freer, more integrated person. Anyway, not a cure.
So, with that said, what actually works?
My bias, the psychodynamic psychotherapy. Now, you don't have to be a psychodynamic therapist, but you need to understand that there are different psychological variables. Some interact, some don't, but many of them occur at different levels of awareness, and they know how to do it. One of the best therapists I know is a Gestalt therapist, pulls out a chair and says like, all right, and this chair is the one who wants to get the job and this chair is the one who doesn't want to get the job. Sit in both and have a conversation with themselves. And that person will be in tears within 15 minutes, or after that hour, they'll say, I know what I need to do. I understand. I get it now. There are many roads to that, but I'm biased towards people who actually understand those processes. For intelligent, successful people, a therapist who's willing to confront them, a therapist who's
Mhm.
willing to say, I think you're kind of wrong, or
Mhm.
or to even call them out and say, that you're coming across like an asshole. Like you've had all of this success, you're putting other people down. You're not your shit probably stinks too. Like you probably have you probably have some stuff going on too. And sometimes that cracks them open like an egg. They will say, I'm actually my biggest critic. I'm actually the meanest to myself. I just treat other people the way I'm mean to myself. Bam, let's talk about that. But we have to confront that. We have to confront that maybe you're not all that in a bag of chips. I don't think that they have to be equivalent in intelligence. They really don't. They just have to give a shit, and they have to have both of those wheels of the bicycle, both warmth and firmness. My own therapist is he's a southerner, so he likes to go, oh, you need to dumb that down for me, and he's very smart. I know that he's doing that, but he's just like, you're purposefully trying to sound smarter. So like, how about you say what you really want to say? And I'm like, oh, you got me.
That's a good
good.
one.
He's good at it.
So what should someone look for, you know? And how do you begin to look? Well, we already talked about the ideal scenario where somebody would have three therapists simultaneously and then choose the best, but
Mhm.
in actuality that is not always feasible. So what are questions, or what are ways in which somebody looking for therapy um, can kind of vet their therapist, or at least figure out it within the next couple of sessions if it's the right one?
I my cop out answer is to trust your gut, not your immediate response, because like I said, the first week you can have a bad experience, but that could have been useful, that could have been helpful. Give them maybe like three or four tries. uh, I like to ask them a little bit more about their own life experiences. Now it's very common for a therapist to like flip a question around. One of my favorite questions is, what jobs did you have before you were a therapist? uh, there'll be a therapist will go, oh, I wonder if that means that you're afraid that I won't understand you. Yeah, no shit. That's why I'm asking you that question. I want to know that you've maybe had, I want to know that maybe you've struggled a little bit. I've been broke most of my life. You knew me when I had $0 in my pocket. Uh, a lot of people, especially people who have the approach that I like, the more psychodynamic or psychoanalytically inclined, they come from money. Like, they don't worry about. They can charge whatever they want. They can pay for offices whether or not they're pulling a profit. Some, especially in, you'll see them a lot in San Francisco, which I think is currently the one of the big centers of psychoanalysis right now, or New York. New York is always a place where you're going to get a high concentration of them. Some of them are second, third generation therapists. Like, their grandparents or their parents already have a successful career. They can just borrow their office, or they just have a job lined up for them. Uh, I want to know that maybe they've gotten their hands dirty. They've worked maybe some blue collar jobs, or they know what it's like to be broke. One of my favorite questions to ask is, do you know what it's like to be hit in the face? Uh, I like I like a therapist who can be scrappy. Essentially, what I'm getting at is not just if I could be understood, but could I be challenged? Could people push back on me? I've mentioned Albert Ellis, the creator of rational emotive behavioral therapy, though that is kind of a cognitive behavioral therapy approach. Uh, he has my favorite story, which is he would have his grad students drive around in public transportation singing "Happy Birthday" at the top of their lungs, and he would make them get embarrassed, because he said, if you're too embarrassed to sing on public transportation, you're going to be too embarrassed to challenge a patient or confront a patient on their bullshit.
Interesting.
That's the kind of stuff that I want to know. Will you tell me I'm wrong? Will you tell me to shut up? Will you tell me, focus? You're all over the place. What are you really trying to get at? I need someone with a little bit more of that grit. I invite people to find their own ways of not quite shit testing them, but but actually checking, will this person push back? Will this person actually be helpful for me?
So let's say that this person, our person in question, smart person in question, is kind of not vibing with therapy, right? They're running into all these situations where, they're feeling like a spreadsheet. They feel like they're not really getting the depth that they need. How can the uh what can they do before they quit, or how can they reframe that, or to continue chasing pursuing therapy?
Well, twofold. One, they could just fire their therapist. I actually think it's good to be able to just look. First of all, we every once in a while I'll get an email like, "Hey, I'm really sorry. I'm so sorry, but I found somebody who's either more affordable or who has a better fit for my goal. Like I found someone who I vibed with more and I'm so sorry." And I want to say, "No, don't be good. I'm thrilled. What's important to me is that you get the right fit. Like I'm fine. Like I get clients. Like I'm happy that you found like please don't apologize." Uh I think good therapists are very comfortable being fired. They're aware they're not for everybody. They know what their strengths are, what other people they might want to refer out for, and other people they're going to say, I don't know if I'm the best fit, but I'll try. But if you want to get one thing, if you want to wedge one thing in before quitting, before firing your therapist, talk about them. Say, hey, I actually don't feel connected with you. I actually don't think that this is an approach that's useful for me. I'm actually wondering if I should look for another therapist. Uh, a good therapist might be able to fold that into work. Tell me about another time where you felt that way. Oh, it reminds me of in college when I felt powerless, or oh, it reminds me of an ex-girlfriend who always made me feel, et cetera, et cetera. A good therapist can turn that into a potent session. An ethical therapist could also say, I understand and that's fine. Tell me what therapist you're kind of looking for, and maybe I'll check through my own Rolodex or my own resources. Maybe I can give you 3 or 4 phone numbers that you can try. Here's the person I recommend who's great at just brief, short-term, solution-focused psychotherapy. If that one therapist gets very defensive, no, I'm trained in internal family systems. I like you need to give me more time. Like this is a process. Maybe that therapist isn't in their own therapy. Maybe that therapist isn't in their own.
Right.
Maybe they're not as skillful as they like to think they are.
Well, we have a comment here, putting that on.
Yes. Always tell your therapist feelings you have towards them that repeat themselves. I completely agree. Like that. So I'm also trained in what we would call relational psychotherapist. I would identify myself as more a developmental therapist. I figure we're always in a sort of development. What are you working on? But those relational dynamics are such a key part of it. If a patient is feeling some way about me, it's very likely that they feel that way about other people. And if they're going, I don't trust that you understand me, tell me about somebody who is important in your life who you didn't feel understood you. Oh, it was my dad. They're in tears. It's a pattern in my life. I've never felt understood. Great. Now we're doing relational psychotherapy. That's also when I talked about countertransference earlier. It's a lot harder when it's about us, when it's our own feeling. But sometimes if we're feeling something, if we're feeling judged or criticized or unfairly treated, we might wonder if there are other people in their life who feel that way. And if they're bringing up that person over and over again, like maybe it's their spouse, you can go, I'm wondering if your spouse feels judged, criticized, devalued, etc., because we're feeling judged, criticized, and devalued. It's much harder to fold countertransference in. But I want to thank, who's that? Ryan? Oh,
Ryan.
I know Ryan. I know Ryan. He's a good dude. Much to Ryan's point, you gotta if they're bringing up a feeling to you, it's very likely that is something that they feel about other people. Oh, Cozy. I like Cozy. Cozy is a veteran. Cozy has a lot of insight. I'm a fan. Thank you, Cozy. Appreciate you.
As always, fan for another show, Diana Gabriela.
Diana, yes,
Always showing up.
longtime fan. Gosh,
Yeah.
she's seen most, if not all, of our episodes.
Oh yeah.
She's a big fan.
Yeah, yeah, yeah. Thank you
We
for that.
we I'm wondering if this is a good time to check in the other X question that I asked.
Yeah,
I
let's do
asked
it.
earlier. I put out kind of a call for a Q&A, and the last I checked, we had 3 questions, and that
Yeah,
was
let's
about
do it.
an hour 15 minutes ago.
Yeah, I wish I could.
What we got?
I wish I could pull these straight into the stream. I don't know how to do that. We'll figure that out. But we'll read. We'll read them. We'll read them.
Do you want to load them up, or should I? I I actually have to refresh my browser for this.
I'll load them up.
1, 2, 3. Oh, we got 5 of them.
Yeah,
6 of them. We got
Good
no
job.
5 of them.
All right, we'll do this. We'll do this for now. So we have a. Let's see. I'm trying to figure out. This is the part that we like.
We love
stuff.
audience interaction. Since our very first, since we were brainstorming for our first episode, we're like, how do we get Q&A? We want to get a Q&A into this. We want to get audience interaction because that makes our job easier, but also like we would not exist without you guys. So thank you all for.
All right, here we go. We have at Cubicle Therapy.
Did you write that out? You are a rock star.
I love that.
Cubicle therapist. How do you, sorry, I don't have my glasses. How do you communicate that intellect doesn't reduce therapy to a quick fix? I'm not sure if I fully understand the question. How do I tell a patient that intellect doesn't reduce therapy to a quick fix?
Yeah, that just because you're smart doesn't mean that therapy is going to be just like, give me the answer and get it done, you know?
Yeah. Oh gosh. I actually think about one of the smartest patients that I've worked with is one of my actual longest term patients. They really said like, just give me solutions, give me answers. And I will tell them, all right, if you want advice, if you want suggestions, we can do it. You're afraid of stuff? Let's do a fear hierarchy. Let's talk about what is the least scary thing, and let's talk about the most scary thing, and let's work up from there. And we abandoned that within 2 or 3 weeks. And I was prepared for that. And I said, it's easy to tell you what to do. What's mostly important to me is how you resist it, because any asshole can give advice. It's you can Google advice. Most people know what to do. They don't know why they're not doing it. This is very common, especially with people with ADHD and ADHD-ish traits. They know what to do. They're not doing what they already know what to do. So I look at essentially these 2 things: the resistance to the awareness of a problem and the resistance to the resolution of a problem. The awareness is half the battle. When they go, oh my gosh, no wonder I drink. It's because my dad was an alcoholic, as there may be cracking a beer and having another one. Oh, hey, that's a great way to do it.
Yeah, I'm just going to pull them up here.
I don't know if I adequately answered that question. I do try to prompt them. I will say I'm not like, we can brainstorm ideas. I'm happy to give you skills. And when we inevitably realize that isn't enough, let's talk about what's missing. Let's actually go to what's holding us back from taking advice or following advice. I hope that answers your question.
Well, Ryan said, you almost stole my saying. It's not what you do, but how you do it that matters.
Ooh, I'm going to put that in my pocket. That's pretty good. It's not what you do, but how you do it.
I like that.
Yeah.
Right on. So back to these. I see that maybe we zoom in a little bit. Oh, hey, yeah. Oh, look at that. That looks good. Perfect.
Yeah, I don't have my glasses, so I am going to ask that you read that to me.
Oh, right on. I got you. Abby at Throwaway Trust. No, Throwaway Trust. Yeah. I've heard of therapists sometimes being biased, thinking if a patient is successful, then they think they don't have an actually mental illness. It's not true, but I've seen it before. One therapist was saying how she thought this one client's bipolar diagnosis was inaccurate.
Yeah, that's tough. I kind of want to make two responses to this. The one is a phrase that always grinds my gears, which is the worried well. Very often when a therapist is working with a patient whose pain kind of exceeds their sophistication, they will say, "You're fine, you don't need therapy." But they're there for a reason. They didn't come because they just want to pay for company. Like, they are suffering and they want to understand their suffering in a meaningful way. The other thing that I want to address is these diagnostic labels, whether somebody does or doesn't have this construct that we call a mental illness. Uh, Much like what you said earlier about cocktails, that even diagnoses are ballpark guidelines. Like, they best describe an aspect of our personhood and an aspect of our humanity. And whether or not they have bipolar is specifically an organic brain illness. It's not all in our head. It's we have a dysregulation of neurochemicals and et cetera, et cetera. Uh, but the even there, I've worked with a specialist in bipolar disorder who argues that there are 8 different bipolar disorders, and he could explain categorically all the 8 different ones.
Mm.
At some point, you need to ask your patient, how is this showing up in your life individually? And when you tell someone, gee, I actually don't think you have bipolar disorder because you don't fit the archetype or the construct that I understand of it, that is not very good therapy.
Yeah.
That's very
Yeah.
limited. You can, even if it is off base. I see this a lot with autism, people who might just have a social anxiety disorder or maybe some personality stuff that they think is autism. I actually don't think it's very necessary to convince them that they don't have autism. Let's
Oh,
just
you're
put it into
smart. Oh, you're
words.
smart. You're successful. You can't be ill. Well, you can't have a mental illness.
Yeah, you have money. You're rich.
You
How
what are
can
you
you
talk what are you
suffer?
talk what are you talking about?
Yeah. Uh, I I think even if something does apply to a large swath of the population, it's still important to look at how that impacts them individually.
Yeah.
Um, Gosh, I recall when I was in training, there was a trainee who was kind of had borderline traits. Debate whether or not she herself had borderline personality disorder. And one of her training cases had borderline personality disorder and was diagnosed multiple times and worked with multiple therapists, as people with borderline personality disorder do. And she says, "Oh, you don't have it." And then their therapy became what it was like to be misdiagnosed with borderline personality disorder for their whole life. And when she was giving this case presentation, everyone was like pulling their hair, going, just because she reminds you of you doesn't mean that they don't have this lifelong pervasive disorder. And honestly, it sounds like textbook borderline personality. Can you not see it because you have those similar traits? Oh
Right,
yeah,
right,
it's
right.
really dangerous.
Interesting. Well, moving on to next one. Pierre Lorenzi at MD underscore Pierre.
Yeah.
Have you ever inadvertently hurt their ego?
Yes. Um, and I'm going to highlight the inadvertently. Like, my own therapeutic style is I do try to take their armor off and expose a nerve. And if I've spent the entire hour exposing the nerve, I'm going to try to like flick it a little bit. I want to see what happens. That's deliberate. That's skillful. There are times where I'm not trying to do that, and I will say something or I won't hear something, and I will hurt the ego. Uh, I don't love it. I don't take pleasure in it, but a lot of times when patients have the confidence to tell me, like, "Hey, man, I didn't like that," or you bruised my ego in their own language, uh, that creates room for repair. And the process of a rift in therapy and then repairing that rift is one of the most potent parts of the psychotherapeutic process. Sometimes they don't come back, but we want to hope. Sometimes I can guess within the week when they're going to come back and they're going to say, "I didn't like what you said," or "I think you were off base," or "You hurt my ego." And um one, I will apologize because I am sorry. I don't take pleasure in that. Um Sometimes patients, it's the first time somebody actually has apologized to them. So I like to apologize early and often for my own shortcomings. I'm human. I make mistakes. But my willingness to move past it and then their willingness to repair that relationship has echoes in their other relationships and how they process their own frustrations and annoyances. So yes, the short answer is yes, I have inadvertently hurt their egos, but my long answer is sometimes that has led to some of the best work that I've done in this
Yeah.
profession.
It's not what you do, it's how you do it.
Yes, thank you, Ryan.
Next one. I don't really know what to make out of this question. What does informed consent look like? I don't know if I understand that one. What do you think?
I'm a big
Avada
I'm,
Gewusst.
oh,
Love that name.
oh gosh, yes. Avada, yeah, I cannot pronounce that. So I think informed consent is very important, but I'm also aware of its limitations. Informed consent is an ongoing process. It's not just you tell them your limitations in the first 5 minutes and that's it. Sometimes you have to remind them. The most basic informed consent are some of our legal requirements. Like if they indicate that they're going to hurt themselves or hurt somebody else, we are legally obligated to take steps to make sure they may be safe. One of them may be safe. But the other one is if we're going to do something new, or if we're going to do an intervention that may bruise the ego, for example. If I have any of my patients who are watching this, they might laugh. But one of the things that I like to say is, "Can I throw a grenade?" I say it compassionately because I know that it's going to maybe be explosive, and we don't know what pieces of shrapnel are going to hit what. And they will say, hit me, like, all right, throw it, like I want to hear it. And sometimes they're even going to brace themselves, but I want their permission because like I'm a supervisor described my style this way of like, listen, I give a crap, I'm your buddy, I'm going to tell you something that you may not like, but I trust that you're going to hear it because I'm here for the right reasons. And I laughed when I heard that. I was like, yeah, that is kind of my therapy approach. But that ongoing informed consent is very important.
Right, yeah.
When you're about to say something they don't like, but also if you're about to try something new, because you can get into a frame of reference where people are used to a certain way of doing it, and like, I want to try something different. I don't know if it's going to work, but like, are you open to trying this? This is what it's going to look like. These might be the risks. For smart and successful people, one of the things that I want to get informed consent with is I want to get in touch with some of your disavowed emotions, often anger. A lot of successful people aren't allowed to express their anger, especially if they're professionally successful in business. You can't start shouting in the middle of a meeting. I work with a handful of professional athletes. The crying, actually being sad. They'll probably have coaches that like nix that when they were children, when they were probably playing kid sports. They're like, what we do may get in touch with some of these big emotions of hurt from anger, sadness, sometimes even fear. And I want to get them aware that that is likely going to be a part of this process. And they say, yep, I'm game, until it happens. And they try to kind of like suck a tear back into their eye like that.
Right, yeah. Everybody thinks that they're down for it until they're there. They're like, oh, actually, I don't know. I'm not sure anymore.
Yeah.
All right.
My short answer is that it's an ongoing process.
Right on. I think we have one last question and time for one last question. So
hey,
let's
perfect
see.
Timing.
Happy days at Happy Kumara. Can they eventually start pseudo-therapizing you and identifying your patterns of relating, etc.?
Ooh, yes. That is a really great question, and I'm sad that I only have 3 minutes to explore it. We could probably just do an entire episode on this, but that would just be for therapists.
Okay.
We are not as invisible as we think we are. Even those of us who are trained in the $20 word is to being a blank screen. Like we don't bring too much of we don't infect the therapy with our own issues. But every once in a while, right? Oh gosh, they will call us out. Patients will go, we can get a haircut, and they'll go, oh, you got a haircut, and we'll be like, oh, we're being perceived too. We'll show up with a wedding ring, and they'll go, oh, did you get married over the weekend? And we're like, I don't want to talk about my stuff. If we have children, very often, people aren't idiots. They know summer comes along and kids are out for school, or if it's spring break, and they'll be like, "Oh, what are you doing with your kids for spring break?" And we're being perceived, but also our own patterns, how we call people out. One of the scariest things we hear, besides "Hey, I took your advice," advice. What advice did I give? Um, is I know what you're gonna say, and we're gonna go, "Ooh, transference. Let's do it." And then they say it, and we're like, "Oh shit, that is what."
Oh damn.
So yeah, it can be very unnerving for the therapist, but we're perceived too. We're two people in a room. At the end of
Yeah,
the
I
day,
was gonna
we're two people
say. I
in a room.
mean, you know, you would hope that you would want to be at least perceive a little bit, just because you're human. I mean, if you know, from if I were in, or you know, when I'm in therapy, I'm like, I want to make sure that I'm talking to a human being. You have a life too, you know. I mean, I'm not gonna start asking you, you know, deeper questions about your children and your marriage, but oh, you know, nice haircut, hey, congrats on your wedding, you know, that kind of
Yeah.
stuff. And
It
that's
it it's not about me, but I'll sometimes get a patient who'll say, "Oh, I know you guys aren't supposed to answer questions, but I want to know blah blah blah." And I'll say, "I'll tell you. I'll tell you the answer to that. It's not about me. If it'll help us relate or connect a little bit more, I'll say it, but then I'm going to put the mirror back to you. Like I'm not going to be like, "Oh, no, you can't know me," cuz we're going to be perceived.
yeah.
It can be terrifying for therapists, but it doesn't have to be, especially if we kind of accept if we accept that.
Well, thank you to everybody that um answer these questions. I mean, amazingly enough, you posted this at 6, so this is right around the time where we're kind of do our pre-show meeting. So not too shabby, just you know, for it being kind of like a last minute kind of
You
throw
know,
out there.
I'm gonna maybe post that about an hour and a half before, because this worked. It was when you were not here for the last 2 weeks. That was how I did some filmed responses, and it got a bunch of hits. But I gave it about an hour and a half before we would normally film, or an hour before we would normally film. I'm gonna do that again. That really worked. Oh, what is this? What is Ryan saying? I will tell you about me, but I'm legitimately curious about why you're asking these things specifically. Yeah. Yeah, I'm not going to hide it. I'm not going to, you know, hide behind my cardigan. I'll answer that question, but I want to know why you're asking that. I want to understand it. Could it maybe be because this is one of the tougher transference interpretations. If you're tracking derivative communication, sorry to use some $10 words here. Uh, uh, if you're tracking derivative communication, you're catching patterns, you're understanding some relational dynamics. And if they ask a question and you look back at this, you're going to say, "I wonder if it's because I canceled last week's session. I'm wondering if you're asking that question because we've been talking about this subject, and you want to know if I actually blah blah blah." Sometimes we miss transference interpretation. Close is enough in horseshoes, hand grenades, and transference interpretations. They can correct you. They can say, "No, it's because of this." Bam, we're still doing therapy. But if we actually go, "Oh my gosh, it didn't occur to me, but yes, that is why I'm asking that question." Oh, we can have great work can come out of that. I
Awesome.
don't want to sound too fancy by talking about transference and countertransference. This is something that I just don't
Well,
think is trained anymore.
I think it's unavoidable.
Well,
We're in a therapy podcast. I think that, you know, you can expect you can throw out some fancy words. I mean,
I
as long as
might
you
want to
explain
do
it.
a whole episode on it, because this is something that I think is missing from, like, the only reason I have adequate training in transference and countertransference is because I had a mentor who was retiring. Like, he was like, "This is my last year, but I'm going to come out and I'm going to teach you this because it's important." And it's just not in training anymore. I think people are trying to they're too far away from Freud that they're forgetting that we're people. We have therapists. We're people too. We have responses.
Right, right. Right on. All right. Well, thank you, Ryan Cozy, for throwing you know, for keeping the chat alive. This is really fun. You're welcome. Thank you. Um, thank you to those who commented on that last minute kind of AMA on X. So, yeah, you know, what else do we got? What else we got, Dr. P?
Yeah, I guess I just want to invite people to do it. We try to broadcast every Monday, 7:30 Eastern. Was it 6:30? Probably your time Central.
That's
And
right.
we every Monday, and our show lives or dies based off whether or not you tell us what you want to see, tell us what you want to hear, tell us what subjects you want us to cover. We did movies and television for the last couple of months, and we had a lot of fun doing it. But tell us what you want us to cover, and we'll try. We're doing it for you.
That's right. That's right. Thank you, everybody.
Yeah. See you next week.
See you next week.